Hey there, welcome back. Today I want to dive into those crazy perimenopause periods. If you're a woman in your late 30s to 40s and you're starting to notice changes to your menstrual cycle, this episode will definitely shed some light for you. So, some of the common changes that you may experience in this stage of life when it comes to your menstrual cycle are your cycle may be shorter. Maybe you always had a regular 28-day cycle like clockwork, but now it's getting closer together like every 20 to 22 days. Your periods may be heavier, so you may notice that you're bleeding a lot heavier, you are changing your pad or tampon much more frequently, and you may even have some clotting. Your periods may be more painful. You're getting cramps and having to take pain meds every month. You may notice some spotting. Typically, this happens at the midpoint of your cycle, or it can happen a few days before your actual bleed. You may notice that your periods themselves are longer, lasting 7 to 9 days versus 4 to 5 days, or whatever they used to be. Your cycle may be longer, so that could last 40 or so days. Some women get a period every 2 or 3 months. And this depends on where you are in perimenopause, whether it's early stage peri or late stage peri, where you're getting closer to menopause. And then you may also notice that your periods are just lighter and shorter, lasting only 2 to 3 days. So what is the deal? As you know, your hormones are changing in this stage of life. Progesterone is declining. This hormone is needed for a healthy brain, your healthy thyroid, sleep, mood, fertility, and you guessed it, healthy periods. So progesterone counterbalances the effects of estrogen. And after 35, you're more prone to anovulatory cycles. This is where you don't ovulate, so you don't make ample progesterone. So estrogen, typically in your 40s, is going to start to fluctuate a lot. And without enough progesterone, the highs and lows of estrogen are much more pronounced, and that can lead to these heavy and or painful periods. Estrogen is not bad. I will say this time and time again. We need it. We love this hormone, but we also need ample progesterone to balance estrogen out. So you end up with unopposed estrogen, which by default puts you in an estrogen dominant like state, even if you have low estrogen levels. And since estrogen is more stimulating, it can lead to growths like uterine fibroids or polyps, and it can cause flare-ups of endometriosis. Endometriosis is when bits of tissue grow outside of the uterus. Now, please know that estrogen doesn't cause endometriosis, but it can exacerbate it. Another thing is adenomyosis, and that is when uterine lining grows in the muscle of your uterine wall. Now, all of these things can cause heavier bleeding and painful periods, and can all be worse, unfortunately, in this stage of life because of the fluctuations in the hormones and the loss of progesterone. And remember, estrogen can be the highest it's ever been in your perimenopausal years before your ovaries eventually stop producing it. So while you may think that you have estrogen dominance, it's more about progesterone deficiency. Lowering estrogen isn't always the goal, especially in your 40s and beyond, because we're already losing this incredible hormone, which has a lot of negative effects on our health. So improving estrogen metabolism or detoxification is really the goal. And that includes doing gut work, opening your detox pathways, and removing estrogen mimicking chemicals from your environment. Essentially, you want to use estrogen and then lose it. And of course, you want to hang on to progesterone as long as you possibly can, but the truth is we are losing it. So you do want to consider replacing it at some point. You know, food and lifestyle changes are a must. I will continue to teach about them, but they only get you so far in your perimenopausal and menopausal years. Once your ovaries slow down production of your sex hormones, they're not coming back. And progesterone in and of itself is such an incredible hormone. It's safe, and honestly, I believe that most women should be on it as early as their mid-30s. I know some people will disagree with me on that, but with the amount of stress that we have nowadays and the chemicals in our environment that mimic estrogen, we need progesterone to balance all of this out. And it has far more benefits than just protecting your uterine lining. Now, all that said, even if you're on HRT, hormone replacement therapy, your periods can still be unpredictable in perimenopause. It's really not realistic to regulate them. Now, if you cycle your HRT, hormone replacement therapy, you may have better luck, but even if you're cycling it, it doesn't guarantee that you're going to have a perfect 28-day cycle. Those days are pretty much gone. Some women will opt for hormonal birth control because they really want to try to regulate their cycle. They want to mitigate any of the symptoms that come with perimenopause. No judgment, of course, but I don't typically recommend that unless you really need it for hormonal birth control. But remember that those are synthetic hormones, okay? They are not bioidentical. And bioidentical hormones are what mimic the molecular structure of the hormones that your body produces naturally. So if you want to manage your symptoms and protect your health and body long term, then you would opt for bioidentical hormones, not synthetic, all right? Now, while irregular periods are incredibly annoying, I get it, I deal with them myself, they are a bit more tolerable than really painful or heavy periods. Those can really disrupt your life. So I want to cover these a little bit more in detail. So about 14 to 25% of women experience longer, which is more than 7 days, or heavier than normal menstrual bleeding. And this can happen at any age, but you will find that it gets worse in your late 30s to 40s with the changes of hormones, like I mentioned. So some other reasons behind long or heavy periods are poor estrogen metabolism, which I just briefly mentioned. That is when you are not detoxing efficiently. And ovulatory cycles are another one. I've mentioned this many times. This is when you don't ovulate, so you don't make progesterone. This is incredibly common in your perimenopausal years. It's also very common with PCOS. That is polycystic ovary syndrome. It is very common. This is when the ovaries overproduce androgens or male hormones. We have these hormones too, just typically they're in lower amounts. Another reason is thyroid dysfunction. An underactive thyroid, known as hypothyroidism, can cause heavy periods or more frequent periods. With hypothyroidism, your pituitary gland can release more prolactin hormone. This is going to suppress ovulation. So you're not going to make that progesterone, and then you're going to end up with an excess of estrogen. Another reason is pelvic inflammatory disease, or PID. This is an infection in one or more of your upper reproductive organs. And then lastly, another reason for heavy or long periods is a coagulation disorder. This is your body's inability to clot blood. And a very common coagulation disorder is known as von Willebrand disease. We've actually had some clients with this. All right, so when it comes to period pain, this is caused by prostaglandins. These are hormone-like compounds which are produced as part of your body's natural healing process. But when levels are high, excess inflammation and pain will occur. And guess what? Progesterone reduces prostaglandins. That's why we love that hormone. And of course, unopposed or fluctuating estrogen is problematic because that affects something called histamine. So this is released by mast cells and also promotes inflammation in the body. Histamine can also have an effect on pain. Many women will notice histamine-like symptoms get worse in perimenopause, such as allergies, anxiety, insomnia, hives, skin rashes or itchy skin, brain fog, headaches, shortness of breath, nausea, and even vomiting. I'm going to have an episode coming up that's all about histamine, so stay tuned for that. And then lastly, you may notice some changes to your bowel movements around your period, and they can worsen in this stage of life. During the first half of your cycle or your follicular phase, estrogen starts to rise slowly. This is going to increase smooth muscle contractions in your digestive tract. So this is when you tend to have good poops and optimal digestion. Now, in the second half of your cycle, known as your luteal phase, that's about 2 weeks after your period, estrogen starts to dip and progesterone will start to rise. Of course, this is if you ovulate. And as you know, that's very spotty in perimenopause. You make a little bit of progesterone, but it's not an ample amount. So progesterone is a muscle relaxant. So things tend to slow down, and that becomes difficult for your bowel to contract, which can cause constipation. So constipation and acid reflux are actually common side effects when you start progesterone HRT. Not for all women, but some women do notice some digestive changes when they start progesterone. But typically these side effects will subside. If they don't, then you maybe have to adjust your dosing, or it likely means that you need some gut support. So not only are menstrual cramps influenced by these prostaglandins, but so is your bowel. And higher levels of these prostaglandins result in more bowel contractions, and that's when we have loose stool, or what a lot of women call period poops. All right, so in a nutshell, to improve your crazy perimenopause periods, you really do need to support a healthier progesterone to estrogen balance, which means considering progesterone HRT, hormone replacement therapy, making sure your detox pathways are open, replenishing lost nutrients that are needed to support detoxification, and of course, managing inflammation. We teach you how to do all of this in the Hormone Rescue program, and we give clients access to functional testing like an HTMA minerals test, as well as a GI map stool test. So the GI map helps us look at your gut function. It looks at levels of bacteria, any overgrowths, infections, inflammation, and there's a marker called beta-glucuronidase. So beta-glucuronidase is an enzyme, and that helps eliminate waste and estrogen from the body. But when it's too high, it's problematic. To decrease your levels of beta-glucuronidase, you're going to want to improve the overall health of your gut. And you want to consider eating some foods that are high in glucuronic acid. Some of these are apples, Brussels sprouts, broccoli, cabbage, lettuce, or leafy greens, and citrus fruits like oranges. Now, some clinicians like to use supplements like calcium D-glucarate or DIM in order to support estrogen metabolism. But I have not found these to be all that helpful. And really, I prefer clients to get into the habit of incorporating more fiber into their diet because it has so many benefits. And that's going to come mostly from vegetables and fruits. And if needed, a fiber supplement. We often recommend fiber supplements to our clients to not only feed the good gut bugs, to help eliminate more regularly and support estrogen metabolism. Something we like, which is really gentle for most people, is sun fiber. And then, of course, you want to support nutrients that, again, I mentioned earlier, are needed for detoxification. Like always, I want to give you some action steps to take if you do struggle with problematic periods in this stage of life. So, number one, I want you to assess and manage the stress that's in your life. I know that this is so much easier said than done. Trust me, I get it. But more often than not, women worry about things that are beyond their control. They say yes when they should say no. They're not great with their boundaries, and they don't prioritize self-care. Please make time for this. You may also want to consider, if your stress is really high, using some adaptogens like rhodiola, ashwagandha, or maca. I will link to the maca brand that I like in the show notes. Number two, you want to avoid extreme exercise. This is going to add some stress to the body, or unnecessary stress to the body. But please don't skip exercise. We need movement. We absolutely need it. I believe that most of us are way too sedentary nowadays, but make sure you make time for some rest days. Too many women will work out 7 days a week and they go hard and they're not allowing their body to actually rest. So consider a mix of strength training as well as walking, and if you enjoy them, yoga and or Pilates. The other thing, number three, is you want to be eating enough whole foods and follow an anti-inflammatory diet. You want to be consuming quality animal and plant protein, healthy fats, lots of veggies, and some fruit. Go back to episode 18 where I dove into the perimenopause diet that I recommend. And then number four, you want to start looking at the products that you're using. So you want to ditch those endocrine disrupting chemicals that are often found in plastics, artificial fragrances, phthalates, and these are things that can contribute to estrogen excess. Number five, you're not going to like me for this one, but I'm going to say it anyway. I want you to start thinking about your relationship with alcohol. Really consider minimizing the consumption of it or removing it altogether. It can not only lead to higher levels of circulating estrogen, which is going to create symptoms of estrogen dominance, like painful heavy periods, but it can also reduce the production of progesterone, and we're already losing this hormone. And it messes with your liver's ability to properly metabolize hormones. So you can end up with an excess of hormones like estrogen that get recirculated in the body. And like I said earlier, we love estrogen, but we need to use it and then lose it. And then number 6, I want you to consider some of these supplements because I know a lot of women want some natural options. Talk to your provider about this, of course, but quality fish oil is something that I recommend as an anti-inflammatory. I'm going to link to one that I like in the show notes. Magnesium is a star mineral that supports hundreds of functions in the body, including detoxification. Some others are ginger or curcumin, and these are both anti-inflammatories. Sulforaphane is something else that's found in cruciferous vegetables, but that inhibits prostaglandins, and you can take it in supplement form. And another one I like is boswellia, and that's also known as frankincense. And this is a great anti-inflammatory for pain relief. And of course, number 7 is you want to consider bioidentical hormone replacement therapy like progesterone. All right, I hope that episode shed some light on these crazy perimenopause periods, that it helped you take some action, and I will see you next week. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.